Hello and welcome to Reach Live. Thank you for being with us. Today, we're talking about driving efficiencies and effectiveness in health and life sciences through digital innovation. I'm Reena Sooch. I head up digital and connected health at Ipsos, and we're a thought partner to Reach. And Reach Live happens every last Friday of the month. So please remember to click and subscribe and follow us. Today we have a great Reach Live session for you. Pharma and digital transformation go hand in hand. And today we have someone with us from Johnson& Johnson, who has a wonderful rich history of looking at digital transformation within the business. So Mrunal, I invite you to say hello and introduce yourself to those here who are watching us on Reach Live. Tell us about yourself, background, before we get into our discussion.
Great. Reena, so excited to be here and thank you for the opportunity. Mrunal Saraiya, I am responsible for advanced technologies at Johnson& Johnson. Been with J&J for 14 years with roles that range from ERP to shaping digital competencies that include data, intelligent automation, blockchain, etc. Prior to J&J, I spent 5 years at Novartis. I spent a lot of time in Basel and the US, and then also have worked with other large companies like Kraft Foods, Miller Brewing Company, and Philip Morris. So looking forward to this great conversation, Reena. Let's take it from here. Serena, just like you said, right? If you want to talk about digital transformation and break it up into so many different pieces, we could have multiple sessions. But to simplify it, um, it's all about technology and solutions that a user can use without massive change management, right? So think about digital transformation in three key buckets. The first being user experience. So you have to ensure that your digital transformation has the simplest of the user experience. And we can all relate to when iPhone came out years back and nobody had to get trained on using the iPhone. The experience was simple, and that really transformed the way we use devices, especially phones, and now everything else we do with all the devices that we have. So that's one aspect of digital transformation. The second is around data and how data can accelerate outcomes. There's a lot of data that's generated over the decades. It's how do we get the data, how do we correlate the data and gain insights from that data and drive the outcomes that we want. And then finally, it's intelligent automation so that we can focus on value added work, so all the manual repetitive tasks can be moved off to the machine, and we as talented kind of leaders in the organization can focus on the patient, what we want to do for the patient, and the outcomes that we want to drive for the patient community. Correct. I think a big part of it is just broader adaptation of digital. So, again, as I said, digital is so broad from a definition standpoint, but for large companies who have been operating in an analog way, that transformation to digital needs to occur. So what needs to happen is a lot of education around what digital is. It's not about the tool set, but the concept of digital, and ensure that those concepts get adapted by organizations, and then those organizations start to go from being taking digitizing activities to becoming digital native, so that everything that we do in the organization, be it all the way from back end office processes to patient and innovation based processes are all redefined in a digital way. So I think that change of mindset to accept digital and going through that transformation is the toughest part of this journey. Hmm. Right, right. Right. So, let's take some consumer examples, and you see a lot of these uh, capabilities and tools that get advertised just on our regular TV networks, right? We've all heard about tools like Cardia that can monitor your heart rhythms and identify anomalies. You see these smart rings from Aura. You see Apple Watch that can monitor your heartbeat and also monitor your other parameters. What is transforming in clinical trials is in a traditional analog world, and this is the world we were in for decades. Is you would kick a doctor would kick off a clinical trial. They would have a trial population of participants, and part of the journey of the participant would be visits to the doctors, a lot of collection of data, and a lot of time that the participant has to spend and the doctor has to spend on manually collecting the data, manually going through the checkups that go on a regular basis. With these new tools that are out there, and these are all consumer grade tools, so they're not tools that are specific to the medical community. They're all available to the consumer world, and they all are connected via the internet, and they are able to send data. So for a doctor who's running a clinical trial, they can now deploy these tools like Cardia, like Aura, like Apple Watches to the patient community that's participating in the clinical trials, have that data collected either in near real time or at regular interval without the patient actually have to leave their home and disrupt their lifestyle, right? And that's the differentiation here. They have an experience that's positive. They have data that's going to the doctor on a regular basis without having to go into a facility, and the doctors can in real time now know how the patient is doing. Now, does that eliminate visits to the doctor completely or to a facility completely? No, but I think it makes it easier for the patient to participate, and it becomes efficient for the doctor to now know what's going on. And in the process now we're shrinking the time frame of clinical trials. And the most exciting part of this change is ultimately the unmet need of the patient who needs therapy that therapy is getting to them a lot more faster because these clinical trials are shrinking, and now we're able to serve the community a lot more efficiently, and that's the best part of this journey. Correct. Right. Great question. So, Rena, I think data is where launch has a great benefit. Once you have patient-centric data to boost the performance of your marketing and sales plan, that's where the differentiation occurs, right? Once you're able to give your field teams a competitive advantage via real-time market views of prescribing trends, and a clear understanding of clinical influence, that's where a lot of this data is now getting synthesized. It's going to the marketing and sales teams by region, by their particular district, and they're able to ensure that the information on the product is getting to the doctors. They have the right kind of tools available to research about the particular therapy, and then of course prescribe that therapy to the patients in need. So I think that that data aspect is very important. But some of the challenges that do come into play here is, as a lot of our product suites move into specialty category, right? So these therapies are distributed with specialty care pharmacies. So in the US especially, the large pharmacies are like CVS, Walgreens, etc., where you get your prescriptions filled, and they already have a lot of data, and that data has already been shared with the life sciences companies. But when it comes to specialty care pharmacies, that's where getting the data becomes challenging. So that's something that the industry needs to solve to ensure that we can continue to have patient-centric data available to the life science companies. Correct. Yeah. So that's another area that is transforming significantly. So, the key here is, how do you enable a field team member with the next best action with data that's generated by a prediction engine, right? So, with all the data that's already available, with of course opportunities to improve data in specialty care pharmacies, how do you ensure that you apply AI and machine learning to then give insights to the field team, right? And ensure that the field team has the right metrics, the right KPIs, and the right data points to ensure that that next best action is applicable and can be deployed. So that's a critical area that a lot of life sciences companies are working on. There is a huge impact once we have the right capabilities deployed, and I believe that that will have a significant revenue impact for life science companies. Now, it does have its challenges. There, we have to shorten the time from when that data is available in the source to how it can make an impact to the field members and the field team members. And I think that's where there has to be some innovation that needs to take place. And of course, there's a lot of boutique companies that do that, and it's a matter of adaptation and get that going. Correct. Mhm. Correct. Mhm. Um, Great point. And I think let's look at the life cycle of the data journey all the way from the start. We talked about clinical trials and how devices will help us be efficient with clinical trials earlier, right? Now, a challenge is to ensure that we eliminate bias in this process. And the reason why that's very important is, this is where equity comes in. So we have all these devices that are available. Clinical trials are looking to be more efficient. Uh, our goal is always to ensure that we support a very diverse patient population in the early stages, which is clinical trials, because we want to make sure that the clinical trials are complete and represent the population that we're serving, right? That's where diversity comes into play, and that's where we have to ensure that as a society we have connectivity challenges solved, because a lot of these devices are connected to the internet. That's where the data starts, and that's where the data needs to get transmitted to these central repositories, so that the digital clinical trials can at the end of the day be a lot more inclusive. So to me, that's something that the society needs to solve, to ensure that we have participation from the diverse population of patients. So that's number one. Number two is also around when we get all this data, and and this data gets analyzed. We write algorithms. There's of course a lot of push of using machine learning and AI tool sets to analyze volumes and volumes of data. We do run a risk of unconsciously inserting bias, right? And again, we're all humans. We all have unconscious biases in us. So it's important that we, as data analysts, data enthusiasts, data scientists, uh, keep that in mind, because what we don't want to happen is having a negative cascading impact on decisions only because we unconsciously inserted bias into our algorithms, right? And that's where it's important that we have a human in the loop concept in the automations that we introduce with data, to ensure that as we automate and as we run these algorithms at scale, there's some level of human machine partnerships that's being thought about, so that we can not only eliminate unconscious bias when we write these algorithms, but we erase bias within the entire life cycle of this data as it moves through the system. Correct. Mhm. So maybe I'll draw an analogy that explains it, and maybe this analogy might not be as reflective of the topic right now, but I think it's a very easy way to explain what the industry is facing today. So as the data is all fragmented in its own data sources, sometimes it's ERPs, sometimes it's other repositories, etc. What the industry has been doing to date, well, it has been creating point solutions. And the way I draw this analogy is, the data is in a box, in jail, and it's coming out on bail every time a solution is being proposed. What we as an industry need to do, and what we do as enterprises, is liberate that data, so that we can democratize the data and make it available to the community, so that we can gain insights, right? So that what's important is to create those data pipelines. And at Johnson & Johnson, we are doing that at scale, so that we focus on liberating the data, getting the data available, accessible, findable, it's cataloged correctly, and they're called the FAIR principles in data. And once those data pipes are created and the data is all available in a common repository, we're now allowing the art of possible to occur when it comes to insights based on the data, right? So once that repository is available, the data scientists can go against the data, and it's almost like pulling a string. And when we keep on pulling that string, data insights start to generate additional opportunities for further insights, and we now create a community of solutions which really start to solve our challenges when it comes to business problem. So I think that's the important part, is to create those data pipes, have the data flowing, make that available, democratize that data availability, and give a lot more power to the data scientists. Something else that's also very common in the data space is, uh, can data be protected and shared at the same time? And very often folks will say, well, they are polar opposite kind of points of views, right? Either data has to be protected, so it's now locked and secured, or data can be shared and it's out there available to everybody. And we as an industry, and this is not just for life sciences, but even for corporate America and corporate world, have to ensure that we merge the protection and sharing into one context and conversation, so that in today's world of cybersecurity, in today's world of more liberation of data, both of these concepts merge together, so that we can ensure that secure data is available to the broader community. Correct. Sure. And maybe I could cover this in a couple of keywords, and then I'll then give a little bit more about those keywords. So, uh, the important first aspect of digital transformation is agile, right? So, digital transformation is not a one and done activity; it's a long term journey. And for a long term journey, none of us can wait for years of getting there, uh, which is a traditional waterfall mindset, to get benefits of those transformations. So it's important to be agile, right? Be iterative, gain the benefits immediately, and keep on working on it and improving on it to ensure that we give value to the business a lot faster. The second one is around data driven. So we talked a lot about data. We talked a lot about data democratization. I think that's just going to be more and more of importance. Data comes in so many different aspects when it comes to devices that are sending out data, when it comes to clinical data, when it comes to research, etc. So that part is super important. And this is where AI, machine learning, human machine partnerships comes into play, because it's so important that that we ensure that data and human machine partnership get explored further, so that we could achieve the outcomes that we need. I'll give you another example of data and human machine partnership. So a leading cancer research organization has digitally created a mouse, right? And as you know, in life sciences, the initial molecular research takes place with testing those molecules on mice, right? And a traditional method is, you have mice in the labs, you see what the impact of molecules are to the mice, and then further research continues. But that takes time. So what this leading cancer institute has done is created a digital mouse in the machine, so that digital version of the molecule can be given to this digital mouse, and insights can be gained very efficiently. And now they can go back and iterate and kind of tweak the molecule based on the response. So again, this is where digital comes in and plays a significant role. And the aspiration there would be to ensure that clinical trials again get a lot more faster, because molecules can come to market a lot more quicker. And then finally is around ethical AI and eliminating bias that we already talked about. So that I think is important. And that in addition to hyper automation. So what we're going to see in the industry and as a vision is, how do we ensure that we can automate at scale so that we can eliminate all that manual activity from our work and focus our valuable human resources to value added work. Because at the end of the day, we want to make sure that we drive a better outcome for our patients in the life sciences industry. And the only way we're going to do that is ensuring that we focus on the right priorities, which is value added priorities.
Interesting. So agile, data-driven, ethical, hyper-automated. It's an interesting future. Is there anything, we're in the final few minutes, but just before I wrap, is there any example of work that you're doing right now that you'd like to share with the audience, or any particular project that you'd like to raise?
Sure. Uh, at Johnson and Johnson, we have a credo which is important for each and every one of our employees, and we place our doctors, nurses, mothers, fathers at the center of everything we do. Because at Johnson and Johnson, we touch a billion lives every single day globally. And as I mentioned before, one of the critical areas that I'm working on is enabling uh, a lot of intelligent capabilities for the business around automation. So we're enabling capabilities like natural language processing, and those allow us to kind of process and review a lot of content, which could be in multiple languages at scale using the machine, with, of course, the human partnership. And that's one of the real examples that I could give you, which allows us to really look at our processes differently. Instead of spending hours and days analyzing all this content, we can just feed it into a natural language processing platform. We could get the output and the insights that we're looking for, and we truly accelerate what we want to achieve as an outcome. So that's one of the examples of how we're applying digital technology and intelligent automation in something that's been done for generations manually.
Fantastic. Well, I love that. Something that was manual that won't be manual. I'm always up for
Correct.
that.
Yep.
Well, with that, we do wrap. I want to thank you so much for your wonderful insight and your time today. Just this is conference season coming, people. I hope for anyone listening, if you're going to be at Vive, you're going to be at Nashville for the International VR Conference, or if you're going to be at HIMSS or South by Southwest, Reach will be there. So be sure to follow Reach, connect with them. There's a huge amount going on at the moment. Get in touch if you'd like to hear more about the work that's happening. Reach will be presenting at many of these places as well. Just click on info@reachtl.org, and they'll be very happy. The team, I'll be there, a few of them. Everyone will be very happy to meet. So yeah, I hope to see you in person at one of the conferences. It'd be wonderful. And otherwise, do keep subscribing. Mrunal, thank you so much for your time today on Reach Live. It's been fantastic to hear about digital transformation and the types of things that we could be excited about.
Thank you, Reena. Appreciate it.
Thank you so much. And thank